Namaste, welcome back to my channel. This is part 2 of infection control practices in a hospital. In a part 1, I have already explained about infection control, SOPs, and hand washing procedures, HAI, hospital acquired infection, and how to manage needle stick injuries. So, in a part 2, I am going to explain you about biomedical waste management, isolation policy, blood and body fluid spill management, and linen management, safe injection and infusion policy, multi-dose vial policy. So let us discuss on biomedical waste management. There are two types of waste. One is general waste and biomedical waste. General waste in the sense non-infectious waste, and biomedical waste it comes under infectious or hazardous waste. Definition of biomedical waste is the waste which is segregated from the hospital during diagnosis, procedure, treatment and immunization. So the biomedical waste is segregated during diagnosis, procedure, treatment and immunization time. So this we used to call it as a biomedical waste. So regarding this in detail of biomedical waste management, I have already done a video, just please go through with that video. And also in a biomedical waste there are four categories of waste. There are yellow, red, blue and PPC, puncture proof container. In a yellow, all infectious soiled waste like incinerable waste will be discarded, and in a red, recyclable waste in the sense plastic infectious waste will be discarded. In a blue, all glassware and metalware infectious waste will be discarded, and in a PPC all sharp waste will be discarded. Isolation policy. So in a infection control, isolation policy also one of the important policy again to control cross infection in the hospital. Patients are isolated when suffering from highly transmissible disease like chickenpox, pulmonary TB, cholera, etc. These patients will be placed in single room to prevent cross infection. So the idea of isolation is again to prevent cross infection from person to person. So that we are going to place a patient in a single room to prevent cross infection. In isolation, we could see there are three types of transmission based isolation. So, airborne isolation, contact isolation, and droplet isolation. Based on the disease condition, will segregate the patient and will be placed in a single room. In a airborne isolation, so airborne isolation in the sense the virus will be present in a air. So, in a airborne isolation, we can see pulmonary TB, H1N1, chickenpox, measles, herpes zoster. So these kind of a disease condition we can see in a airborne isolation. Again, we have to place the patient in a single room and practice isolation practices. Contact isolation. So by touching or by contacting a patient or surface, the disease may transfer from person to person. In that case, like MRSA positive, cholera, pseudomonas, chickenpox, herpes zoster, hepatitis A. So these are all the patients or disease condition comes under contact isolation. Again, contact isolation patients also will be placed in a single room and isolation practices will be performed. Droplet isolation. In a droplet isolation, see in the by sneezing or coughing, the infection will spread from person to person. So again, to prevent that, we have to place the patient in a single room. Under the droplet isolation, we could see meningococcal, meningitis, influenza, mumps and German measles. So these are all the transmissional based isolation categories. And again in detail of this isolation policy, I already made a video, please go through with that. So I have explained in detail of isolation practices. Airborne isolation precautions are patient to be placed in single room, Masks to be worn by the patient and those who enter the patient rooms. Maintain 3 to 5 feet distance while interacting with the patient. Susceptible persons should not enter the room and must be washed thoroughly after touching the patient or potentially contaminated articles and before taking care of other patient. Articles contaminated with infective material must be discarded or reusable items should be disinfected with 1% sodium hypochlorite solution. Do not allow patient to walk outside the room. Close the door all the time to maintain negative pressure ventilation in the room. So in airborne isolation, first and foremost thing is placing patient in a single room. It is very important, and wearing of a mask also very important practice, and always should maintain 3 to 5 feet whenever we are interacting with the patient, and those who are immunocompromised persons should not enter to the patient room. Maximum in disinfection and cleaning policy has to be maintained in the room and should not allow the patient to walk around outside the room. Maximum negative pressure should be maintained in a airborne isolation room. And next one is contact isolation precautions. Contact precautions prevent spread of organism from an infected patient through direct touching a patient or interact touching surfaces or object in contact with a patient. Contact patient to be placed in a private room or with a roommate who has same infection. Healthcare workers should wear gloves when entering the room. They should change their gloves if they touch material that contain large volume of organisms such as salt dressings. So again, in a contact isolation, placing of patient in single room is very important, and also we can put the patient, those who are having same infections, we can place the patient, two patient also in a single room, those who are having same disease condition. And also here in a contact isolation, wearing of a glove is very important. That is important personal protective equipments, again to prevent spreading of infection or prevent cross infections from the patient. And maximum here also cleaning and disinfection activity has to be performed all the time. And next one is droplet infections or droplet precautions. Again here also place the patient in a single room. Droplet infections are spread when a patient coughs, talks or sneezes. Healthcare workers will need to wear mask within 3 feet of the patient. Patients moving about hospital away from the isolation room should wear mask. Example of disease requiring droplet precautions are meningococcal meningitis, bacterial infections of the lining of the brain, and influenza, mumps and German measles or rubella. So these many comes under droplet infections. In a droplet infections, again we have to place the patient in a single room, and here gloves and mask both are important, and maintaining of 3 feet distance also very important. Here also maximum cleaning disinfection activities has to be performed to prevent cross infection. And next one is barrier nursing. Barrier nursing in the sense patient will be placed in single room to prevent spreading of infection from patient to healthcare worker and patient attender. So the target of barrier nursing is the infection should not spread from the patient to healthcare worker. And in a reverse barrier nursing, the purpose of reverse barrier nursing is to prevent infection to the immunocompromised patient. Example, neutropenic patient, thrombocytopenia patient, burns patient, chemotherapeutic or organ transplant patient. So here the target is the patient is immunocompromised, so that infection should not spread from the healthcare workers or from other patient to the immunocompromised patient. So here we need to protect the patient from the infection. That is the target of reverse barrier nursing. Next important practices in infection control is cleaning, disinfection and sterilization process. So again these practices also will reduce the infections rate in the hospital. So cleaning, so before doing disinfection and sterilization, cleaning is very important. Unless without cleaning we should not make any disinfection or sterilization process. So in the sense, what is the meaning of cleaning? Cleaning is general removal of debris like removal of dirt, food, feces, blood, saliva and other body secretion. So in a cleaning we are going to just removing of the dirt on the surfaces or on the articles. In a disinfection process, this process will kill microorganism but not bacterial spores. So here some kind of a disinfection process will happen. It will kill some kind of a microorganism. Okay, in a sterilization process, with killing of all kind of microorganism and bacterial spores. So in this process we are going to killing of all kind of microorganism as well as bacterial spores. So these are all the main important cleaning, disinfection and sterilization practices we are performing in the hospital, again to prevent cross infections or infections rate in the hospital. So in a cleaning, disinfection and sterilization practices, we have to follow some of the items or things will go for only cleaning and some of them will go for a cleaning and disinfection and some of the items will go for cleaning, disinfection and sterilization process. So in that case again there are critical items, semi-critical items and non-critical items. Based on that we have to clean, disinfect and sterilize. So what are the critical items? So critical items require sterilization include items that enter sterile tissue or the vascular system, example surgical items, biopsy forceps, implant, cardiac catheter. So these critical items must and should we should wash. First cleaning process has to be performed and after that disinfection. Finally this has to be sterilized because this will enter to the sterile tissue or vascular system. So in that case all critical items should be sterilized properly. Next one is semi-critical items. It requires minimum high level disinfection. It includes items in contact with non-intact skin or mucous membrane. Example laryngoscope, endoscope, bronchoscope, vaginal ultrasonic probe. So these are all, this will enter to the mucous membrane or on the intact skin. So these many items require only cleaning and disinfection practices. And in a non-critical items it requires intermediate level or low level disinfection. Includes items in contact only intact skin. Example BP operator, thermometer, stethoscope, patient equipments. So these many items require only the cleaning practice. Next one is blood and body fluid spill management. This is also one of the important practices we should perform in the hospital again to prevent cross infections. So whenever there is a blood and body fluids, we should have a spill kit to manage this procedure and always keep a caution board near to the spillage area. The staff will rank to the housekeeping in charge and inform about the spill. The housekeeping staff will reach the spillage area and receive the spill kit from the nursing staff. HK will wear personal protective equipments and use disposable paper towel or tissue to cover the spill. Pour 1% hypochlorite solution and leave it for 5 to 10 minutes contact period. The absorbent paper is picked up and placed in the yellow bag and disposed in a infected waste container. Carefully clean the spill site of any visible material from the edges of the spill. Rinse the spill site with the soap and water and air dry. Discard the glove for clearing the spillage site into the red container. Wash hands with soap and water. Mercury spill management. Well ventilate the room by opening the windows. Evacuate the patient from the room. Remove all the jewels. Wear personal protective equipment, preferably double mask and gloves. Gather all mercury spill with the help of X-ray sheets. Aspirate with a syringe. Release water-filled bottle. Finally, seal the bottle. Put it in the big container. Seal it and again place into the double black cover. Write a label mercury spill for segregation, then hand over to biomedical engineer. Document in the spill register and inform to ICN. This is regarding mercury spill management. And next important infection control practices is safe injection policy. There are three things we should know in a safe injection policy. The first point is needle and syringe are single use device. They should not be used for more than one patient or reused to drop additional medications. And the second point is do not administer medications from a single dose vial or IV bag to multiple patients. The third point is limit the use of multi-dose vial and discard it the single patient whenever possible. In a safe injection policy, multi-dose vial policy is very important thing. Regarding this multi-dose vial policy, I have made a video. Please go through with that multi-dose vial policy. Management of linen. So this is also one of the important practices in infection control. There are types of linen: dry linen and soiled or infected linen. Dry linen are linen used by the patient but not stained or infected. Soiled linen or infected linens are linen stained with the blood and body fluids or vomits, urine, feces, etc. So dry linen are a non-infectious linen and soiled infected linen has to be disinfected properly. Sluicing method. The linen is transported in the buckets to the local washing area. Soiled and infected linen is transported separately. The linen is directly emptied into the dedicated container in specifically allocated area. A 20-minute soaking will be done. Water containing sodium hypochlorite 1% and water is drained. Normal wash is given again with the water for 5 to 10 minutes. So here the concept is all infected linen has to be disinfected with the sodium hypochlorite or any disinfectant solution. Then only it has to be sent for the normal wash.